All right. One more moment. Okay. Make sure that this is working. Okay. Can everybody see the slideshow?
We can all see the first slide.
Okay. And it's not wanting to. I'm going to try it again. Okay. Let's see if this works. Here we go. There we go. Okay. So today we will be kicking off our Fatal Five series with a discussion of the condition sepsis. The Fatal Five is a series that focuses on what the five most common causes of death in our clients, individuals with developmental disabilities, are, what symptoms to look out for, which of our clients are most vulnerable, and most importantly, how to avoid these conditions, or at least complications that these conditions can cause, if at all possible. And just as a preview, next month we plan on addressing aspiration. So our objectives today are to discuss what the immune system is, what sepsis is, complications and challenges that can arise from the development of sepsis, as well as how sepsis presents in our clients. So let's start with the immune system. The purpose of the immune system is to protect the body from foreign particles that enter the body. There are different levels of immune system protection that they are the innate and the acquired levels. And then innate immunity can be further broken down into cellular immunity and barrier-based immunities. So innate immunity is what it basically sounds like. It is what you are born with that protects you from potential pathogens or infection-causing agents. One portion, as I mentioned earlier, is the cellular immunity, and this is comprised of white blood cells, including also the helper proteins and cells that assist white blood cells in doing their jobs, as well as inflammatory response, which is a response to any potential pathogens. And basically, any particle that enters the body that the body does not recognize as self will be treated as a potential pathogen. So just to keep that in mind. This little diagram here shows white blood cells as well as some of the helper cells, proteins that help them do their job. Um, some of them work more specifically than others. Um, in the white blood cells, there are cells that attack basically anything that comes at them. There are cells that are designed for like a antihistamine or a histamine response. So that would be in the presence of an allergen. There are other cells that are created in an increased amount when there is a bacterial infection or a parasitic infection. So there are different types of cells that have more specialized functions. And make sure, sorry, I got lost there for a moment. So once the immune system encounters a potential pathogen, it's going to start producing more white blood cells to help put or stave off that potential infection. And it'll do it based upon what it encounters. And then once the potential pathogen or pathogen has been dealt with, the white blood or the immune system is going to back off. In addition to that, um, there will be the inflammatory response. So the inflammatory response is the purpose of that is to help get white blood cells to where they need to be to help prevent infection or cure an infection. Or that's not the quite right term I want to use, but it'll work for now. So it does this by causing the blood vessels to dilate, which increases blood flow, which can be presented as heat and sometimes redness, depending on what kind of infection or inflammatory response we're looking at. So for example, say you cut your finger open and that um, the inside of your body is going to recognize that, hey, there's something here that's not supposed to be. The external environment's touching me. So it's going to increase blood flow to the area, which is why we have bleeding, of course. It's going to get warm, it's going to be swollen, and that is because the body's trying to get bloods or white blood cells to the sorry, I need to somebody's because could you please turn off your mics if you're not asking a question? Thank you. Um, I apologize. I got a little distracted there. So that will be present as increased heat and redness to the area. And that is so that those white blood cells can get in there. And also clotting factors to help, clot off the wound, and, take care of any potential infectious causing agents. It also increases permeability or the ability for like cells to go through the vascular system or the veins. So that way, fluid and white blood cells can get into the tissues to help um, get rid of a pathogen. So, for example, someone has like a pneumonia, the capillaries or the blood cells or the blood vessels will become more permeable in that area. So that way, white blood cells can get to where that infectious agent is and destroy it. And then that should back off at some point. This will also help, or the inflammatory response will also attract leukocytes, which are a white blood cell to that site of infection. And it will also, sorry, this will, the attraction of all these cells and all this extra fluid can also increase swelling, tenderness, or cause tenderness and pain due to that swelling. So those are just things to consider with the immune system. The inflammatory response is a very natural response. It does have a specific purpose. And if it's not able to do its job, the body is not going to be able to fight off infection as efficiently. Another form of innate immunity is barrier level. And this can be divided up into three different sections, which is the physical barrier, which can include skin or mucous membranes, mechanical barriers, which could include tears, urine, coughing, or even, I don't know why I put stomach acid there. Stomach acid is supposed to be, I apologize. Stomach acid is supposed to be under chemical, and then also chemical barriers. Um, so the physical barriers, of course, prevent a pathogen from entering the body. In the instance of mucous membranes, that mucus layer will trap potential pathogens and particles, so that way they can be shed from the body. There's also antimicrobial proteins present in the mucus, and that will also help neutralize any microbes that might be present. And when I'm talking about mucous membranes, it's not just like the inside of your mouth, which is a pretty common mucous membrane. This can also be inside the intestinal tract. If it does encounter a pathogen, it can basically surround it, and then the little fibers in that on the cell or on the intestinal wall can help push that that pathogen out. As far as mechanical barriers, tears, if something gets in your eye, I'm sure you're very familiar with. Um, it's very painful, and you start crying to try and flush whatever that is out of your eye. So that is one of the purposes of tears, is to help move potential pathogens out of the eye. And tears also have a chemical property. There are proteins that are inside tears that can also help decrease the risk of infection. Urine as a mechanical barrier may not sound, or it may sound a little bit strange, but urine, the process of urinating flushes microbes out of the urinary tract. So that can help prevent urinary tract infections. And then moving down into chemical, those are things like sweat or sebum, which is oil that's secreted from the skin. Those have uh, like sweat has salts inside of it that have antimicrobial properties. Sebum or skin oils have a lower pH, which is used or which can neutralize microbes or at least decrease their ability to replicate. And then there's stomach acid that's secreted, of course, in the stomach that has a very low pH. Um, and sorry, my dog's barking. Um, has a very low pH, which of course can destroy microbes. All right. And now moving on to acquired immunity. So it is acquired from outside of the body. There are adaptive forms of acquired immunity and passive forms. So adaptive is form of immunity that develops in response to either an infection or vaccination. And this can either be natural or artificial. Vaccines are used to present either a portion of a viral particle to the body to recognize as, this is not supposed to be in the body. Make sure you build white blood cells that know how to neutralize this pathogen. So that way in the future, if you are actually exposed to that virus, your body's like, hey, I know what you are. You don't belong here. And it already knows how to make that white blood cell to fight that virus, that specific virus. And so it can ramp up real fast, neutralize the pathogen as quickly as possible. And then this can usually result in no illness because that virus was never allowed to replicate to the point that the individual got sick. Or it can result in very mild symptoms because your body's able to fight off that virus much quicker than if your body hadn't already been made aware that what that virus looks like. There are other types of vaccinations called attenuated viruses, and basically that is when they take the virus and they remove the portion of the virus that makes it pathogenic or makes you sick, and then introduces that altered virus to your system so that way your body can recognize that virus. And so that way in the future, if it does encounter it in light or, in the real world, your body knows how to effectively destroy that virus without the infection causing portion or the illness causing portion of the virus, if that makes sense. Um, and then through natural means, exposure to pathogens. So you get sick with something, with a virus or some sort of illness, your body will, of course, make white blood cells to neutralize that specific virus. And you're not likely to get that illness again unless you didn't have a very good immune response. There are exceptions, but often you won't get that illness again, or it won't be as severe when it comes to viruses. And moving on into passive, so this is a form of immunity that is passed on from someone or somewhere else. Um, in natural situations, this is like an instance where a mother passes antibodies to her baby, either in utero or through breast milk. And then artificial antibodies can be administered through a medication. For example, like a gamma globulin injection or infusion. So now that we've discussed briefly the immune system, we can start in on what sepsis is. So sepsis is the result of the immune system going into overdrive, resulting in widespread inflammation. As I mentioned previously, or I hope I mentioned previously, when a potential pathogen is discovered inside the body, the response is localized. It wouldn't make sense for your body to make a bunch of white blood cells and send them all over your body for an infection or, in one area or a wound in one area. When the immune system goes into overdrive and is producing, all these chemicals and cells to fight an infection, and it becomes widespread, it can start causing a lot of problems. For this reason, sepsis is identified as something that needs to be um, when when a person goes into the hospital and they're showing signs of sepsis, they're immediately put on like a sepsis alert, because there are things that need to happen very quickly to prevent the sepsis from getting worse. Um, as you can see in this infogram, there are different stages of sepsis. The worst, of course, being septic shock, which can result in death. If not treated quickly, sepsis can result in very low blood pressure, which can reduce blood flow to organs, which can decrease, oxygen in those organs. It can actually, in severe cases, result in organ damage. And as I had mentioned previously, when the blood vessels dilate to increase blood flow to a specific area, if this happens oh, on a whole body global scale, you can say, um, the individual's blood pressure will drop significantly, what we would call hypotension. Um, Additionally, that permeability of the blood vessels causes extracellular fluid within the blood vessels to escape out of the blood vessels, which is where we want it, but it'll escape into the interstitial spaces, which is that space between organs and cells. Um, when this happens and there's not enough blood perfusing organs, this can cause, of course, organ damage and death. Um, and another thing to consider with sepsis is it can cause a condition called disseminated intravascular coagulation. I don't expect you to remember that, but one of the goals, as I mentioned before, with the inflammation response is to help also bring coagulation factors to the source of infection. And when this becomes a widespread or global condition, there can be little blood clots that form throughout the entire body, and can cause damage to organs and cause bleeding, like internal bleeding. So it's a very serious condition and one that we want to make sure we keep our eye out for, and have treated as soon as possible. Some symptoms that you might see with someone who has experienced sepsis as a result of infection are shaking and chills, which is generally the result of fever, extreme pain or discomfort. They can have pale, warm, clammy, like sweaty skin. It sometimes presents as confusion and disorientation. It can cause shortness of breath, rapid heart rate. There is a rash that is associated with sepsis. It's a red rash that's, what's the word I want to use? Um, it can cause a red rash. That's the best way I can describe it right now. I apologize. And then also, as I'd mentioned before, can also cause low blood pressure, and also fever or low body temperature or hyperthermia. So our clients who are hospitalized with sepsis are more severely ill than those other individuals who are hospitalized for other conditions. They have considerably longer lengths of stay in the hospital than those who are hospitalized for those other conditions. And they are more likely to die during hospitalization, compared to those hospitalized for other conditions. And when it comes to sepsis, um, like I said, it is important to get treatment as soon as possible. The longer treatment is delayed, the more difficult sepsis is to treat, and the more likely very negative outcomes are possible. So there are some common conditions that we see in our clients that can lead to sepsis. This is pneumonia, UTI, bowel obstruction, pressure injuries, or cellulitis. Um, Pneumonia is not always caused by a bacteria, or not a bacteria or a virus, but it can also be caused by a bacteria that can either be aspirated or inhaled into the respiratory tract. So we'll start there. So our clients are at an increased risk for respiratory infections for several possible reasons. Some of our clients have anatomic abnormalities that do make them a greater risk for having a pneumonia due to aspiration. For example, some of our clients might have strictures in their esophagus that make it difficult for them to swallow, so they're more likely to have an aspiration event. Some of our clients have, as like here at the bottom, GERD, which is reflux, can also cause stomach contents to be aspirated into the respiratory tract. Um, Also, some of our clients are dependent on caregivers for feeding. And if we're not really careful and paying attention to how our clients are eating, it can be easy for some of our clients to aspirate their foods. And this could be, their stomach fills up, they're not able to say that their stomach's full, and it can back up into their respiratory tract. Or our clients might have faulty sphincters, like esophageal sphincters, which keep the stomach contents inside the stomach. They might have like paralysis of that sphincter, or there might be hypotonia, which is a lack of muscle control. And so that can cause leaking into the esophagus. And if one of our clients is mobile and they're laying down a lot, that can eventually go back up the esophagus and then be aspirated into the respiratory system. So symptoms that you might see with an individual who has a respiratory infection or cough, which again is that mechanical um, drive of the body to try and clear that infection from the lungs or the respiratory tract. Sneezing, which is very much the similar response or immune response, trying to get whatever that pathogen is, whatever that particle is, out of the nasal cavity. You can see fever with the client, so that would be a response of the immune system, of course, to try and combat that infection. You can see fatigue or lethargy, so changes in activity level might be seen in a client. There could be a complaint of sore throat. Sign that a client might have a sore throat, even if they're not able to tell you, is if they're, touching their throat, or they're touching their face frequently, or they're having difficulty eating. Some clients may report chest pain or show that they're having any chest discomfort. They could be breathing quickly. So if they're breathing rapidly, that could be a sign that they're not getting enough oxygen. They could potentially have loss of appetite, and that's not necessarily from sore throat. It could be that they're just not feeling well and they're not able to eat. And also atypical breath sounds. And that would be, if you hear somebody wheezing, or if it sounds crackly when they're breathing, could be a very good sign of an infection or a pneumonia. I'll go back for a minute there. So if you're seeing any of these symptoms in your clients, it's really important to make sure that they're being assessed appropriately. Either seeing their doctor, depending on symptoms. If it's severe, we want them going to the hospital. And if we're concerned about sepsis, definitely hospital right away. And one of the things that we can do to help our clients prevent our clients from experiencing these conditions is, making sure that they get annual flu shots. So that way their risk of developing pneumonia from flu is decreased. Making sure that, if we have a client who's being tube fed, that they're sitting up for the appropriate amount of time after tube feed is administered. So that way that decreases the risk of regurgitation and aspiration into the airway. So those are just some things to consider for our clients. Moving on to urinary tract infections. This is very common, especially in females, because of anatomical purpose reasons. The female urethra is much shorter than the male urethra. And because it's so much shorter, it doesn't take as much time for bacteria to get from the outside of the body up into the bladder and then up into the potentially the kidneys if it gets that bad. Hopefully we don't get there. With males, the urethra is much longer. And as long as the individual is drinking enough fluid and urinating frequently, or at least at appropriate regular intervals, that urine should flush the bacteria out of the urethra. If that's not happening, of course, we can develop a UTI. So if someone is not urinate, abnormal voiding patterns can of course cause a UTI. And if someone's not urinating frequently, that increases the amount of time for that bacteria to travel up the urethra and into the bladder where it can really become nasty. Poor hygiene can also cause urinary tract infections if our clients are not being cleaned appropriately or they're not cleaning themselves appropriately. We could be introducing more bacteria around that urinary or that urethral opening, which can cause that bacteria to get up into the urethra and then, of course, into the bladder. So this is important to remind our clients who are providing their own care that it's, especially for women, wiping front to back. So that way we're wiping from like the cleanest area to the dirtiest area because we don't want to be cleaning the dirtiest area to the cleanest. That's not going to help. For our male clients, making sure that, if especially with our clients who are not circumcised, making sure that, they are, providing care to that area to make sure that we are, there's nothing growing underneath that foreskin. So making sure that that's clean. And if you are the one providing care, of course, just making sure that you follow those guidelines as well. For our clients who have neurogenic bladder, these are clients who do not um, are not able to control their bladder, so they're not able to relax the sphincter that holds the urine in the bladder. And so if that's the case, that's called urinary retention, and the bladder would become full, and it increases the chance of an infection solidifying inside the bladder, and it also increases the risk of bacteria coming up the urethra because it's not being flushed out um, frequently enough. Or, there are some individuals with a neurogenic bladder who they can't sense when that sphincter relaxes and they can have frequent accidents throughout the day. Um, Another way that neurogenic bladder could increase the risk of UTI is if the individual requires an indwelling catheter um, at all times. So that way they're constantly draining their bladder because they're not able to do it on their own. Some clients also have the ability to do intermittent catheterization or self-catheterization. And this is just, on regular intervals. They know that they need to empty their bladder, so they'll insert a catheter, drain their bladder, and then remove the catheter and throw it away. The risk with catheters is that anytime you're putting anything up the urethra, it increases the risk of moving potentially infectious agents from outside of the body in through the urethra. And there's naturally occurring bacteria on our skin at all times, and it has a purpose on the exterior of our body. A lot of those bacteria are very beneficial where they're supposed to be. If they get into the bladder or any other organ system, honestly, that's when we have problems. So that was one thing to consider though with the catheters is that anytime you're putting a catheter in, it's increasing that risk of infection. Um, in regards to the indwelling catheters, it's not so much that you're putting a catheter in multiple times during a day. Um, it's that if the catheter is not cleaned appropriately around that urethral opening, bacteria can collect on that catheter and grow up the catheter into the bladder. And for this reason, it's really important for our clients who are doing their own catheter care, educating them that they need to clean around that catheter and then away from the catheter so they're not pulling bacteria up to that urethral opening. And if you are, of course, providing that care, just making sure you're following those guidelines. And if you do have any questions, make sure that you're referring to the care plan for that condition, for that catheter. So that way you're making sure that you're um, following the appropriate care for your client every time you're handling that catheter. So symptoms you might see in a client who has a urinary tract infection are confusion, agitation, poor motor skills or dizziness, which could result in falls, as well as other behavioral changes. And something to consider is UTIs can sometimes be mistaken for early onset dementia or Alzheimer's disease. And that is, of course, because of the confusion and agitation. Frequently, I've seen in long-term care facilities for the elderly, women, especially women, can become very confused and agitated, and they go into the hospital, and people are concerned, dementia of, exacerbation of dementias, and the first thing they usually test for in that case is for a UTI because it's the one of the most common causes of confusion and agitation in elderly individuals, especially women. Other things you might see with a client is increased urinary frequency or painful urination or pain in the bladder. They could have fever. They can complain of abdominal or low back pain. Usually, if someone's complaining of low back pain and it's related to UTI, that means the infection's gotten up generally into their kidneys, which is really not great. We want to make sure that's taken care of as soon as possible. You can also see foul, well, not see, but there might be foul smelling urine, or the urine could look cloudy, or it could even have blood in it. And those are all potential signs of a urinary tract infection. And depending on the client's symptoms, this could be something, that, their primary just prescribes an over-the-counter, or not an over-the-counter, they prescribe a antibiotic to clear up the infection, and that can be done at home. In other cases, IV antibiotics might be necessary. If you are not sure the severity level of a client's potential urinary tract infection, it's always safest to take them to the ER to be evaluated and have a doctor make that determination. It would be really unfortunate to think that a client's potential urinary tract infection isn't severe enough to need to go to the hospital, and then only to find out that it is, and there's a delay in care. So just some things to think about in regards to UTIs or any infection, honestly, to be, yeah. So moving on to gastrointestinal illnesses that can cause infection, that can lead to sepsis. And again, this isn't another potential issue or anatomic abnormalities. So for our clients who have like their intestinal their intestine is not structured in I guess you could say the normal or the expected way, can cause issues. So there are some conditions where intestinal narrowing could be a potential complication, and that would be that there's a narrowing of the tract, stool's not able to move through it, or whatever substance it is. I know this is including the upper GI tract, but I kind of already mentioned that a little bit earlier with GERD. As far as to the lower GI tract, if there is a stricture in the intestine, this would prevent stool from moving through the intestine appropriately and can result in either an obstruction or, constipation issues. There are other conditions where a client could have a fistula, which is an opening that it's not supposed to be there, and that can cause leakage outside of the intestinal or outside of the intestine. Some of our clients have problems with motility of their intestines, and this could be due to genetic conditions they have, or for individuals with cerebral palsy who have motility issues, their gut is not working fast enough or appropriately, and it can lead to constipation because stool's not moving through the bowel at the speed that it needs to prevent constipation. And of course, constipation is the hardening of stool within the bowel, and this is a result of either, as I mentioned, slow decreased motility. So the stool is not moving through the bowel fast enough, which means more water is being pulled out, which means the stool is going to be getting harder. This can result in a bowel obstruction, which is where nothing can get past a blockage inside the bowel. And this can result in herniation of the bowel, which is, the bowel opens up, which can result, of course, in sepsis because now there's stool inside the abdominal cavity, which is absolutely not supposed to be there. Or it can cause backing up of the stool into the stomach, which of course can back up into the esophagus. Very not a great situation. In that case, you might see vomiting or nausea with your client. Other symptoms you might see with someone who is having a gastrointestinal issue are complaints of pain or discomfort or signs of pain or discomfort. They could be having nausea or vomiting, behavioral changes, including irritability and restlessness. You might also see, of course, lethargy or increased aggression due to pain. The client may have decreased appetite. They could have weight loss, or they could be having, constipation or diarrhea. For our clients who are at risk for GI complications, it's really important to make sure that we are monitoring their GI system. So if we have a client who has chronic constipation, make sure that we're monitoring how frequently they're having bowel movements, what their bowel movements look like. If our client is independent in toileting, making sure we have an open conversation with our clients about what their bowel patterns look like. And I know that can be difficult. Some clients probably don't want to talk about it. If we can find a way to have that discussion with our clients, so that way they're comfortable, um, that would, making sure that, we know what's going on. So if we're seeing that they haven't had a bowel movement for 3 days, we're we're intervening if possible. If we don't already have orders for, as needed bowel medications, making sure we're going to the provider saying, hey, so and so's not had a bowel movement for several days. They're having abdominal pain. Can we please get, some as needed medications for this so that way we can prevent any complications? Um, and of course, if you do already have those orders set, then you can at least administer them and try and get the constipation resolved. If you're not able to get that resolved, we want to make sure that they are evaluated in the ER as soon as possible to make sure that it doesn't progress to something more severe. If we're not monitoring our clients who have chronic constipation via bowel log or however that's communicated from staff member to staff member, it is possible to go way or so many days without a bowel movement. And I know that it sounds like an exaggeration, but I have seen instances not in this line or, in this job, but, historically when I've worked in the hospital or in other areas, I've seen clients not have bowel movements for over a week and no one has been aware. And it can have very catastrophic outcomes. And aside from an infection that could lead to sepsis, it could result in needing, an ostomy, which is the artificial opening in the bowel because, part of the bowel has been damaged from that bowel obstruction, that chronic constipation. So we just want to avoid those complications if at all possible. So cellulitis, this is a bacterial infection of the skin. It can be introduced through a cut, scrape, burn, bug bite. Basically, any break in the skin has the potential of allowing bacteria in and causing an infection. And this, of course, can lead to sepsis. Basically, any infection can lead to sepsis if it's not cared for in an appropriate time frame. Common symptoms that you might see with someone who has sepsis are reddened skin, skin that is warm to the touch, swelling, pain. In some cases, you might see what's called exudate or leakage from the skin, and that could be just like a watery leakage. It could also be purulent, which pus basically. Um, so this, of course, can spread quickly if it's untreated. Individuals with diabetes or individuals who are immunocompromised are at higher risk for developing cellulitis and having worse outcomes because of their condition. So individuals with diabetes, one of the reasons why they're increased risk for infection is many individuals with diabetes have another condition called, oh my gosh, I'm blanking on the term. They can have problems with their nervous system where they're not able to um, feel appropriately. So this could be they can't feel at all. This could be they constantly feel pins and needles. Basically, that altered sensation prevents some individuals from knowing when they've been hurt. This is very common to be seen in the feet. Because if you're not checking your feet all the time and you can't feel your feet, you don't know if you've stepped on something and broken your skin and it's infected and you have no idea because your feeling sensation is altered. So with our clients who are diabetic, it's really important to make sure that either you guys are checking their feet on a frequent basis or scheduled basis, or that your client is able to, if they're able to do it, making sure that they are, um, this would definitely decrease risk of not necessarily, it might not prevent infection, but it can prevent the infection from getting worse to the point that they need to be hospitalized. And if a client has cellulitis, make sure that you're seeking care. And if it's spreading, making sure the provider's aware, making sure that you're seeking medical treatment as soon as possible for that. And then moving on to pressure ulcers. So our clients who are most at risk for developing pressure injuries or pressure ulcers are those who have mobility issues or have issues with nutrition. So one of the reasons why immobility or altered mobility can cause pressure injuries is because there's prolonged pressure, typically on a pressure point that causes an interruption in the blood flow, which causes cellular death, which can result in, of course, a pressure injury. In this image, you can see common or potential sources, or frequently seen areas of pressure injury. And that could be the back of the head for someone who's been lying down in the same position. This could be the shoulders or the elbows. You can see that on the coccyx or the hips. Also can see on the inside of the knees or on the heels of the foot or backs of the legs. So basically anywhere there is a body part that is against a surface for a prolonged period of time can result in a pressure injury. The reason why malnutrition can contribute to I guess the evolution of a pressure injury is that protein is a really important part of the healing process and creating new tissues. And if a client's not getting enough of that in their diet, their body's not able to replace dead tissues or dying tissues at a frequency that they need to. And so they're more likely to develop damage that their body can't correct, especially in areas of prolonged pressure. And if you are not familiar, these are the stages that you might see with a pressure injury. In your facilities, you're only likely going to see a stage 1 or 2 at the most. Stage 3 and 4 require significantly more care and are generally treated like in a long-term sort of setting. And they do take a lot longer to heal. So it's important to know with a pressure injury, they may be painful and they might not be. For individuals who have severe pressure ulcers, they might not have any pain because the nerves have all died in that area. So they can't sense that they're having pain. There can be foul odor coming from the pressure injury if it's open. And then other signs and symptoms of infection, of course, fever, shakes, just the overall feeling of not feeling well, clamminess, sweatiness. So all those standard signs of infection could also be potential here. And then, of course, as I said, there are the different stages of pressure injury. A stage 1 pressure injury is a spot of blanchable redness or non-blanchable redness. So that would be if you press your finger on it and it doesn't turn white or yellow, like if that blood doesn't push out of that area, if it stays red, that is a sign of a pressure injury. Stage 2 is when that stage 1 opens up. So the skin is broken, and so you can see, or the top layer of the epidermis is open, or even down into the dermis, that sublayer of the skin is open to the air, and that would be a stage 2. A stage 3 is where the injury extends into the subcutaneous fat layer. And then a stage 4 is when that injury goes, all the way into the muscle, into the bone. In some cases, a client might develop what is called an unstageable pressure injury. And what this looks like is a wound that looks like it's scabbed, but you can't determine what it looks like underneath, which is why they call it an unstageable, because they don't know how far down that injury has gone. And that the only way to find out how bad it is, of course, is to do something called debridement, which is incredibly painful. That's when that dead tissue is removed from the wound. The wound is cleaned out so they can determine how far that injury has gone into the tissues. And then something, I don't know if you can read it in the slide, excuse me. There's a condition called undermining, and that's when that injury extends underneath the skin tissue, not necessarily straight down. And this can cause pockets underneath the skin that's still intact that are infected, or there's dead tissue underneath. And it requires very special care. And then the last section I want to talk about are oral infections, because this is pretty common with some of our clients, especially those who are adverse to oral care, whether it's a sensory issue or whether it's just, it's not something that is part of their routine and they don't want to deal with it. Um, this can be very challenging. So there's, of course, the mouth has a lot going on. There's a lot of different places that you can see an infection, whether it's in the gums due to lack of brushing. So you could see like gingivitis, or, if the lips are broken, or the palate, which is, the roof of the mouth, or, underneath the tongue. It could be an opening in the cheek. It could be an opening or wound on the tongue. Another thing to consider is, and this one I do see more often than I'd like, an abscess in the mouth. Could be even underneath the tooth. And this is where there's a pocket of infection that can be on the root of the tooth or like around the tooth. This is very painful, causes a lot of swelling. Sorry, my dog. Big stop. Um, so in that case, a dentist will need to examine the client to see how bad the infection is, see if oral antibiotics are sufficient, or if surgery is necessary. In the case that surgery is necessary, a client will most likely be referred to a periodontist or an oral surgeon. Symptoms you might see in your clients who have an oral infection are increased sensitivity or pain of the mouth, decreased appetite because it hurts to eat. They could be having fever. They could have foul breath. There could be bleeding at the gum line, especially when they're brushing. There could be discharge or pus from any wounds in the mouth. If you have a client who's holding their face or mouth, that could be a sign of pain or discomfort. And again, any behavioral changes that are unexplained could be a sign of an infection going on, which is basically across the board for any infection. So that is what I have for you today about sepsis. If you do have any questions, please feel free to jump in. I did want to mention again this provider information call tomorrow morning from the Department of Social Services about prohibited and restricted health conditions. The ID for the webinar on Zoom is listed here. And then I am going to put that link again into the chat box if you want to register.
Letter opener.
Put this on. And again, that'll be 10 a.m. to 11:30 a.m. tomorrow. Does anyone have any questions for me? Or any input or feedback? Okay. I'm going to move on to my next slide here, and it just has our contact information in case you do have any questions for us here at the Regional Center. On the top here, I have Jen Badger. She is one of our other nurses here in Reading. And if you do need to get a hold of any of us, the nurse's email is the best way to get a hold of us. Any questions you're having regarding any support that we can give you for your clients, please reach out to us, especially when it comes to our clients who have restricted health conditions that you may need support with. Please feel free to reach out at any time. Okay. Well, since I don't think anyone has any questions, I am going to stop the recording.
I just wanted to hop on real quick. So I have 4 people who I messaged privately who have not signed in. So you won't be getting a CEU if I don't have you signed in.